special day, we have gathered here for the launch of one of the most unique, path-breaking and phenomenal projects of public health in the state of Goa, the Stemi Goa project. Self-identified Stemi centers using tele-ECG designed by Tricog Health Services Private Limited, Bengaluru. A tele-ECG machine is a machine that records and transmits ECG to a remote center where it is reported by doctors 24/7 and sent back to the treating doctor in record turnaround time of less than 5 minutes. The doctor at this peripheral health center can then evaluate the patient accordingly and begin treatment without delay.
Keeping in line with the aims and objectives of Ayushman Bharat, the Stemi Goa project aims in taking the best health practices and modern technology to all parts of state and benefit the rich and the poor alike. Today, Stemi Goa project will be launched.
Stemi basically stands for ST elevation myocardial infarction, which is basically a kind of a heart attack. It is a heart attack, so it's one particular type of a heart attack. The heart muscle, which does all the work in pumping the blood throughout the body, requires blood supply to function, and that comes to the arteries that supply the heart. The arteries of the heart have normal structure. At the same time, sometimes as early as in the second decade itself, plaque starts building up inside these vessels, grows over time, and hopefully not very early in life, but more often later in life sometimes, this will cause a heart attack because of a rupture of that plaque, which allows a blood clot to form and block that artery, and thereby the heart muscle that's supplied by that artery starts literally dying, and that's what causes our symptoms, and that is what causes all the problems that a heart attack causes, including death.
And you and I are some of the most fortunate people on planet Earth, because if there's a problem, we know where to go, and we know good doctors who will treat us. Most of India is not one such. So the vision of the minister and the entire people here is to give everybody the same equal opportunity so that their lives can be saved. And I applaud what all of you are doing together, and I'll give you a good example. Today I visited in the morning the district hospital at Mapsa. Are there any of you from here? So here I was with my team visiting the emergency room, and there's these one 80-year-old and one 70-year-old who came in with chest pain. And even during the implementation of the project, the medical officer took an ECG, 2 heart attacks happening at the same time. Immediately the nurse came, sir, we have to give this treatment. They consulted with the physicians over there. Treatment was given in front of my eyes within minutes. There were 2 ambulances that were dispatched. And what was shocking to me was there was one cardiac ambulance and another advanced ambulance. And the discussion was not what do I do with the patient, but which patient do I send in the ambulance. Right? The Goa Medical College were informed, and the patients were underway all within a couple of minutes. And that, ladies and gentlemen, is what you are creating. The envy of the healthcare systems around the world.
Though, as said by founder Tricog, that similar tele-ECG has been utilized by various hospitals, but not under any public healthcare system. So Goa would be the first state which will be implementing this Stemi project by making use of the technology to reduce the time taken for the cardiac intervention to address the Stemi patient. So in that light, I would say that we are creating history by becoming the first state in the country to have a full-fledged Stemi project under the public healthcare system.
And I'm so grateful to the Honorable Chief Minister for having set up the Department of Cardiology in the Goa Medical College. It is only through this Department of Cardiology, also Dr. Guru Prasad mentioned that initially it was Victor Apollo that was doing all the angiography and all the cardiac related interventions initially. They were the pioneers in it in the state of Goa, as a result of which people from Goa didn't have to go outside the state of Goa. Let me also say that today we have got an excellent team of cardiologists in the Goa Medical College. The finest doctors who work day and night at any given time you call them up. With a smile, they answer the call and they are there available for us to take this forward. It is so important that this innovative step, that's what I was talking to Dr. Guru Prasad the other day, that we need to take this step and move forward. It is very important that we all unite and we have all become a part of a team, just like Mr. Ashok Kumar mentioned. The reason being that our mission, which we constantly keep on mentioning, is saving lives. And you can keep on saving lives if you take advantage of different types of new innovations, new technology, and most importantly is what is the practical situation on the ground. Today, if you go to a place like Kankon or you go to a place like Sattari, today you find that in the past, people were not accessible to this type of healthcare. A person gets a cardiac problem, then there was no future for him. Many times people have lost their lives coming to the hospital. I know several people who have come and collapsed in the hospital because there was no that type of facility for the patient to be revived or for the patient to get this type of treatment that we are talking about today. I would also like to mention to you that these type of situations in a minister doesn't function just because he wants to do something new and innovative. It is a team. It is a team of professionals, team of experts, all come together. We all discuss, brainstorm. We have got a fine secretary with us, Mr. Ashok Kumar, who I always tell, the objective is X. We must see how we can achieve this objective, and who's been very cooperative on various initiatives of healthcare. If somebody is staying in the remote place of Goa and has all the wealth but doesn't have access to this type of healthcare, then you cannot save his life. And I still remember the instances. That time we had Dr. Theodore and Dr. N.G.K. Sharma who accompanied me to St. Clement, and we came down. He was head of Department of Medicine. And I've gone through this whole thing. That's why I'm very, very particular that healthcare and health services in the state of Goa must be of a certain level. We must get the best expertise and the best doctors from outside the state of Goa into the state of Goa. There are so many doctors of Goan origin who want to come and contribute to the development of healthcare in the state of Goa. And for that type of facility and that type of model integrated with the private sector is the only workable model in the state of Goa. I'm of the opinion that capacity building was also very important. If we don't have that type of capacities in our own setup, then we must involve the private sector so that we can take them and move forward. Our doctors in the health services also are doing great jobs. They are doing excellent service. Whatever limited facilities that they have got, they're trying to utilize it to give best healthcare to the people in the state of Goa.